Greetings everyone. Today's topic will be on World Medical Ethics and Geneva Declaration of Geneva and all the ethical principles and the duties of physicians, duties towards the public and duties towards other. So the World Medical Association Code of Ethics and Declaration of Geneva, it was adopted in the year October 1949. So, what are the duties of a physician or duties of a physician in general? A physician should always exercise professional judgment and maintain highest standards of professional conduct. A respect, commitment, and the patient's right to preserve the respect or to refuse the treatment. So it is basically an autonomy. The patient has his own right to choose his mode of treatment, and we as a physician has to respect that autonomy. And you should not allow your judgment to be influenced for personal profit. So anything your treatment given or treatment planning, anything should not be biased towards your financial gain or any kind of gain. So it should be purely on the welfare of the patient alone. So whatever there are certain code of ethics which can vary according to geographical location, either state or according to a nation or something. You should always respect that code of ethics. The physician or the dentist should be dedicated to provide competent medical service with compassion, passion, and respect for human dignity. Should always strive for the healthcare resources in the best way possible to benefit the patient and their community. So the physician should always respect the rights, preferences of patients, colleagues, and other professionals. So the physician should seek appropriate care and attention if he or she suffers from any physical or mental illness. So moving to the next part of the duty that is the physician's duty towards patients. So a physician should always respect human life and should always act in the best interest of the patient. So in case of any emergency care or a humanitarian basis, the physician should always do his duty. Okay. So the physician should be ready to willing give any emergency care during such instances. And another thing is that so the physician or dentist should always maintain a professional relationship. So he must not be engaged in any sexual relationship with his current or previous patient or the places where he visits as a physician. And in situations where the patient is acting for third party, so the patient should have the full knowledge of what is the health status of the patient. Next is the duties towards physicians and colleague. So the patient should behave towards the colleague that he should have mutual respect and there should be a proper code of conduct. So there should be a communication. So for instance, uh, in case of the physician is not available for one particular day, the physician knows it beforehand. So he must give that pass on information that he is not available for that next consecutive day and what are all the duties or what are the responsibilities on the part of physician. He or she must ensure that the other colleagues, that his superiors or his colleagues, everyone should be intimated about what are the roles and responsibilities are during those days and whether they are given any particular appointment or whether the appointment has been rescheduled. So these are like basic courtesies or duties towards your physician. All the information should be given them. So in case if the physician is having any appointment unavoidable thing where the patient is persistent that he has to be taken care on that particular day, everything has to be notified to this colleagues and the colleagues must be requested to take care of that any treatment procedure. So likewise, this communication is very, very crucial, especially for a dentist or a doctor, so that there is no hassle and there is no misunderstanding on the patient or the thing. Everything has to be communicated clearly. So the patient doesn't show up on the day and he is given the message that the doctor is not available. All those information, all these mishap can be avoided. So the physician should not undermine the patient-physician relationship of colleagues in order to attract patients. So there is a dignity for the profession. We should not undermine the dignity. So whenever there is a medical necessity, so the physician should communicate with colleagues who are involved in care of same patient. So it might be a situation there, as a general physician, the doctor is given only the doctor general physician has given only the primary or the emergency, this thing, to just emergency treatment just to stabilize or stabilize the patients, or just to save the patient from any emergency situations or accidents or trauma, whatever it is. So in that case, as soon as the physician stabilizes the patient, the other procedures and everything might be done by other specialists like orthopedician or something. In that case, that the general physician has to tell that either tell, preferably in records at least, what all the treatment he has done, what time and everything, including his name, signature and everything. So what are the vitals and everything, everything should be noted. So that the next doctor who's a specialist who will take care of the patient, so they will have a proper track record of the patient. So likewise, you can give this example for dentist also. So for instance, the dentist just does an emergency treatment in case extraction or something, and the dentist refers to a root canal treatment to a endodontist or something. So everything has to be communicated. Next, we are moving on to the Declaration of Geneva. So it was adopted during the Second General Assembly of World Medical Association, Geneva, Switzerland, during September 1948. At the time of being admitted as the member of medical profession, this following medical oath has to be taken. So all of us would have taken this oath during right before we begin studying for this profession. I solemnly pledge to consecrate my life to the service of humanity. I will give to my teachers the respect and gratitude that is their due. I will practice my profession with conscience and dignity. The health of my patient will be my first consideration. I will respect the secrets that are confined in me even after the patient has died. So this is also a very important point, where the physician has to maintain the confidentiality. So the physician should not give any informations to others about the whereabouts of the patients. So only one exception is under the court of law. I will maintain by all means in my power the honor and noble traditions of the medical profession. My colleagues will be my sisters and brothers. I will not permit considerations of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing or any other factor to intervene between my duty and my patients. So this is very, very important. Whatever may be personal grudge or anything you might have, so even those cases, you should treat the patient with utmost care. So these are all the Declaration of Geneva. I will maintain the utmost respect for human life. I will not use any medical knowledge to violate human rights and civil liberties, even under threat. I will make these promises solemnly, freely, upon and honor these. So it is mandatory for all the doctors to remember this every day in their routine practice, and we have to follow this at all times and no exceptions. So there is this is not non-negotiable as a physician and a dentist.